Sit here.
Thank you. Before we start the meeting, I've asked Mr. Blake to open up with a prayer.
Thank you, Lord, for this day. May many more come. We thank you for all the blessings you have bestowed upon us. We ask that you watch over our family and constituents, wherever they may be. We ask all this in your holy and precious name, Lord. Amen.
Thank you, Mr. Blake. One agenda item today, folks, and just being cognitive of the time, the minister has to leave by 1, so it's a public briefing on mental health, wellness and addiction recovery action plan with Minister Abernethy, Minister of Health and Social Service and staff. Before we go to you, Minister, I'll get my colleagues to introduce themselves, starting on my left.
Good afternoon, Frederick Blake, MLA for Mackenzie Delta.
Good afternoon, Tom Bollier, MLA for Tuneda Willady.
Kieran Tester, member for Cam Lake. Good afternoon.
Julie Green, Yellowknife Center.
Good afternoon, Shane Thompson, Nahindi. On my left is Lee Selleck, our policy analyst, and on our right is Jennifer Frankie Smith. Oh, sorry, we've lost Jen, now she's back. So. Anyway, at this point in time, Minister, I'd like to turn the floor over to you for opening comments and to introduce yourself. Thank you.
Thank you, Mr. Chair.
Sorry, we just one other individual. I forgot to. Michael.
Oh, Michael Natalie Detchell.
Okay, thank you, Minister.
Thank you, Mr. Chair. And I'd like to thank committee for providing me with an opportunity to present the draft mental wellness and addictions recovery plan. I'd like to begin by introducing some officials from the Department of Health and Social Services who are with us here today. Bruce Cooper, who is the Deputy Minister, Les Harrison, who is the Assistant Deputy Minister, Families and Communities, Kate Sills, the Senior Advisor to the Deputy Minister, Sarah Chordakowski, Manager Mental Health and Addictions, and Susan Laramie, who is my Ministerial Special Advisor. Mr. Chair, this draft action plan is the final deliverable under the strategic framework for mind and spirit promoting mental health and addictions recovery in the Northwest Territories that was released in November 2016. It also follows the release of the Child and Youth Mental Wellness Action Plan that was released September 2017. While the original intention was to create two action plans, one for mental health and one for addictions, the draft action plan combines mental wellness and addictions recovery into one overall action plan. This combined approach better aligns with best practices and recognizes that these areas are often linked and are both rooted in social determinants of health. The action plan is based on best practice research, jurisdictional scans, and engagement activities with a number of key stakeholders, including engagement and feedback from people with lived experience, engagement and feedback from non-government organizations, including the Arctic Indigenous Wellness Foundation, Tree of Peace, and others, and an interdepartmental working group, including the Departments of Education, Culture and Employment, Justice, Municipal and Community Affairs, and the Housing Corporation, and all three Health and Social Services authorities. Along with recommendations from the Committee Report 4-18-3 Adult Residential Addictions Treatment Facility Tour 2017, the action plan also reflects previous consultation and public engagement activities, including the validation exercise with our Indigenous governments, engagement with 130 youth from across the Northwest Territories, recommendations from the expert panel review, an interactive radio show, public consultation on Bill 55, the new NWT Mental Health Act, and recommendations from the Ministers' Forum on Addictions and Community Wellness. The draft action plan strongly aligns with the mandate of the 18th Legislative Assembly by ensuring services are delivered locally with culturally appropriate methods and taking action on the crisis of family and community violence. Mr. Chair, I'd like to turn it over to Bruce Cooper, who will walk committee through the presentation that provides more details on these specific action plans. We tried to keep the presentation short as possible, but it is going to be a little bit longer than the 10 minutes that is suggested by committees, but I think the detail is important.
Okay, thank you, Minister Abernethy. Mr. Cooper.
Thank you, Mr. Chair, and thank you to everybody for the opportunity to provide an overview of our recovery action plan. We're happy to be here today, and we do look forward to your input before we finalize this plan. Today's presentation is really in two sections. The first number of slides provide some background regarding the foundation stone that the action plan is built on, our strategic framework, and some highlights of our current service delivery model, just to set the stage for what we are doing over the next 2 years. Then the action plan itself, the objectives, the key actions. The plan contains some 33 actions that we want to accomplish over the next 2 years, so I'm going to focus my comments on some of the highlights in the interest of time. Slide 2. So, as the Minister referenced, the Department launched the Mind and Spirit Strategic Framework in November 16 as a means of addressing priorities of this 18th Assembly. Our intention was to release action plans related to the needs of children and youth, mental wellness and addictions. We did release a Child and Youth Mental Wellness Action Plan in September of 2017 that was designed to support child and youth mental wellness. And the action plan we are discussing here today is our second deliverable and brings together mental health and addictions actions into one integrated plan, given that they are often one integrated issue. You will recall slide 3, the strategic framework has 4 strategic directions that guide our work on mental health and addictions in the coming years. A focus on prevention and early intervention, a movement towards a more recovery-orientated system, and a recognition that in that system, recovery means different things for different people. And moving towards a system where we're engaging with our clients so that our programs and services shift to respond more appropriately to their needs, and that we provide training and capacity building in our system to improve outcomes. And the final strategic point of the compass is, like all significant health issues, and mental health and addictions issues are only successfully dealt with when dealt with holistically and with a focus on social determinants. So a whole government approach is important. Slide 4, please. This slide provides an example of the utilization of some of our existing programs and the investments that are made in these programs. It's not a comprehensive listing of investments. For example, it doesn't include inpatient and hospitalization costs associated with mental health and addictions issues. We know we have very high rates of hospitalizations for these issues. But it does provide a little bit of context in terms of utilization of our community counseling program, facility-based treatment, shelters, and our On the Land Healing Fund. The next slide provides a demonstration of the array of services that we deliver or support others in delivering to address mental health and addictions challenges facing people in the territory. We provide services that are that evolve along the continuum from prevention and health promotion. We have an array of treatment-focused services. We have services to address crisis, and those designed to build capacity and resiliency. And so some of the services you see on this slide have been in place for some time and will look very familiar to people, and some are relatively new and have come to life in the past 2 years. If we move to the next slide, this is a deeper dive into some of the recent investments. These are some of the investments that we've made or policy or program decisions that have been made recently that are focused on mental health and addictions recovery. These initiatives represent new options for residents, but also system enhancements that address quality assurance and improved care. So you can see we have the new Mental Health Act and the review board under that act. We have investments in last year's and this year's budget for child and youth care counselors. Suicide Prevention and Crisis Support Network has been new, and investments in the year that we're in. And family violence shelter funding, there's been some new movement there. We have $730,000 coming into this year that we're reprofiling to move towards land-based mobile addictions treatment, which will support Indigenous governments to implement land-based addictions treatment and aftercare programming. And we're also moving to improve our information management through the establishment of a community counseling information system. So that's the foundation that we're building on. The draft Mental Wellness and Addictions Recovery Action Plan outlines 33 activities over the next 2 years. The draft plan contains activities that we are resourced for and we're able to deliver on over the next 2 years. It doesn't include actions that are part of our normal ongoing quality improvement activities and policy thinking that will be happening over the next 2 years. And it does, what this does do, It certainly brings together, as I said, the mental health and addiction side, and this is our final deliverable. And the minister's already covered the process that we went through to deliver the plan, the best practices reviews and engagement. To the action plan itself, the next slide 8. The action plan has 4 broad objectives to support the overall goal, which is to provide a holistic, person and family-centered approach to care that fosters hope, promotes personal choice, and builds partnerships to support each person's individual and unique journey to recovery. So moving now to slide 9, which is the first objective. Our first objective is to increase awareness and to reduce stigma and to create safe and supportive services. This objective has 5 activities to be completed over the next 2 years, and I want to highlight 2 of them in particular. We know that we already offer a range of services and supports for mental wellness and addictions recovery. However, we know that residents are not always aware of these services or how to access them. We also know that sometimes the way we think people need to get this information actually doesn't align. Sometimes we tend towards app-based approaches or even use of social media, when in fact we've heard from our residents that sometimes a simple poster or a home screen on a computer in a school are great ways to tell people about services that are available. So to address this recognition, we will be engaging with residents to determine the best ways to reach them with information about mental health and addictions, as well as converting that knowledge from that engagement into some new and creative approaches to providing information to residents. We also know that we have some work to do to continue to build the capacity in our system to provide safe, non-stigmatizing spaces for residents to receive services. So we are going to be providing training for professionals within our system in terms of trauma-informed care, but also the cultural safety work that we're doing as a department aligns here as well. Moving to slide 10, this is objective 2, which is to enhance community, land-based, and cultural supports. This objective also has 5 actions that we're going to complete in the next 2 years. These are on page 9 of the action plan, and I'd like to highlight 2 of the 5 actions now. So we know that recovery from addictions is easier with support from people who understand the journey and the associated challenges. We will leverage lived experience by implementing more peer support options for individuals working on recovery from addictions. And I've got a little bit more to say about aftercare and peer support coming up. We will also be working to provide community-based options for addictions treatment that allow residents to remain closer to home. And that will be done through the On the Land Healing Fund that will be enabling Indigenous governments to deliver these land-based mobile addictions treatment. I would note that both of these activities respond to recommendations made by the committee following a tour of facility-based addictions treatment in December of 17, where there was a clear need for peer support options and addictions recovery to provide for family supports. Objective 3 is to provide equitable access to mental wellness and addictions recovery services and supports. This objective has 19 activities to be completed over the next 2 years, and these can be found on page 11 and 12 of the action plan. So on the slide you'll see I have 3 actions, but I actually want to highlight 4. I appear to have deleted something inadvertently. The first item that you'll see under this action is the movement towards a seamless care pathway approach, and this is something that we spoke about in our child and youth mental health plan. Essentially, moving to a seamless care pathway, or others call it stepped care approach, is about making sure that people have the right services to meet their needs when they need them, and that we have differential responses available to people, so that we have resources that match the need that people have identified. So we're going to be creating more options for people in the next 2 years by implementing e-mental health options that residents can use in addition to or in place of face-to-face services like mental health counseling. Developing clear referral pathways between the different mental health and addictions programs and services. We're going to be implementing tools and protocols for frontline staff to guide their work and ensure standardization across the territory. And we're going to be offering a variety of scheduling options to meet the diverse needs of residents to reduce wait times. And an example of this would be the use of single-session walk-in counseling. There's some very exciting things happening in our country in relation to stepped care and seamless care. There have been jurisdictions that have gone from having significant wait lists. Once they've implemented this approach within a year, there are some jurisdictions that now have no wait lists because they have moved to this kind of stepped care approach where there's a better job done matching the individual to a richer array of services. We're also going to be establishing an advisory council of people with lived experience. And this group will inform the implementation of our seamless care pathway as well as provide guidance and insight into other mental health and addictions related initiatives that we need to be undertaking. Alcohol addiction is the most common reason residents seek addictions treatment. It's also at the root of many of the issues facing our territory. And we're going to be working with our partners in other departments to take concerted efforts to reduce harms alcohol causes in the territory. And we are in the process now of working with our federal partners to identify resources that will support the creation of, we're going to be establishing a task force that will be looking at the development of a territorial alcohol plan. And this will certainly respond to recommendations recently made by the Canadian Institute of Substance Use Research, and that is looking at the a more profound whole-of-government approach needed to reduce alcohol-related harms and costs. We're also going to be providing additional training in addictions assessment and aftercare for frontline staff, particularly our counselors, and we will be developing tools and standards to ensure we improve standardization of our approach across the territory. Moving to slide 12, objective 4, we are going to move to enhance the availability and accessibility of family violence supports. You're all aware that rates of family violence in our territory are approximately 8 times the national average. This is a key area that needs coordinated and timely attention, and as such, this is why we've chosen this as an important objective. There are 6 activities to be completed over the next 2 years on page 14 of the action plan. So, for example, we will be working with other social envelope departments to be developing a collaborative approach to addressing family violence, and this work will identify best practices and priority areas that span the full spectrum of prevention, support for victims, and programming. As you know, the department supports 5 family violence shelters across the territory, and to support the shelters in the work that they do and to ensure safe and quality services, we will be implementing operational standards for the family violence shelters. We've been doing this work, and we expect to have that concluded through the next year. So, looking forward, slide 13. When our staff look ahead 2 years and think about the story that we want to be able to tell about the difference this action plan makes, it's our intention to take action that will have tangible impact on access, that will improve aftercare, and that will overall make a significant difference in the service quality and ultimately contributing to improved outcomes. Most importantly, we want clients to be able to tell a story that they were more aware of services and supports as a result of things that we've done in this plan, that they know better how to access services that are available, that there are more options available to choose to address issues, online options, on the land options, peer support, face-to-face counseling, facility-based treatment. Access will be more timely, and people will have access to flexible scheduling options for counseling. Same-day access will, and the work of better matching needs with resources will reduce wait lists. When accessing counseling, residents will receive service from a counselor who is trauma-informed, we're hoping that most of our staff will be trained in cultural safety by this time, and will be well versed in addictions aftercare, and that our staff will be fully aware of the full range of supports and services that are available to support recovery, not just the ones in the health and social services system, but also what services that are delivered by NGOs, by Indigenous groups, and in community. If attending facility-based treatment, we want, in 2 years, our residents will have more aftercare options to support their recovery upon return home. There will be more peer support options. There will be more land-based options, and as I said, online app-based options. But as you know, aftercare is not really a program. We can't do aftercare and peer support in a top-down manner. It requires partnership and engagement, and that's what we're working on. We are actively working on this issue with the residential facilities that we contract with for services. We are also, through the establishment of our advisory council, we will be working with them on identifying improvements needed within the territory. And we're also going to be interested in hearing ideas from community and existing peer support programs and initiatives like AA regarding what we can do to support them in providing improved peer support and aftercare. So, in conclusion, as we look ahead over the next 2 years, we're going to continue to engage with our residents to help shape the programs and services to best respond to the needs. The establishment of our advisory council is going to be certainly critical to that. In addition, we will be monitoring data sources and reviewing our community counseling program stats, addictions treatment stats, shelter statistics, utilization statistics on an ongoing basis to track changes. We're also going to be reporting out on this through our Health and Social Services annual report. And we will be tracking a cluster of indicators that are on page 15 of the draft action plan, as ultimately what we need to work towards is really making a difference on improving, starting to bend the utilization of hospitals as a place where people have to come for treatment. So ultimately we're trying to move towards that more outcome focused approach. And we will naturally be continuing to report on patient experience within our community counseling program and using that information to make quality improvements over time. Thank you.
Thank you, Mr. Cooper. Questions? Ms. Green.
Thank you. I'd like to go to page 4 of the slide presentation. The words family violence occur once in the mind and spirit strategy and not in the context of providing service. I'd like to know why family violence shelters are included in this action plan.
Thank you, Ms. Green. Mr. Cooper.
Thank you. Well, this plan represents an integration of a number of issues, and we felt family violence is so integrated within the work that is done by the staff in this area. It was hard for us not to consider family violence as part of the overall strategy for improving outcomes in mental health and addictions. It's both it's something that can be a consequence and it can be a contributor, so that's why we brought it inside this framework.
Thank you, Mr. Cooper. Ms. Green.
Yeah, what evidence do you have that it's primarily women who use the family violence shelters, that they have addictions and mental health issues that should be included in this plan, that they are disproportionately affected and thus should be in this plan?
Thank you, Ms. Green. Mr. Cooper.
Don't have any specific utilization statistics around that, but certainly when we look at the cases that our staff deal with, these issues are not these issues do permeate the experiences often of people that use the service.
Thank you, Mr. Cooper. Ms. Green.
Yeah, have you considered the stigmatizing effect of including family violence shelters in this addictions and recovery plan? I feel very strongly that it has that effect, and I'd like to know that you've considered that effect. Thank you.
Thank you, Ms. Green. Mr. Cooper.
Certainly stigma is something that we're very concerned about, and part of working to create a society that is stigma-free is to try to normalize these issues. And so, I mean, I can certainly understand the point that is being raised, and it's something that is being presented here in the context of the people that are going to guide this work in our community counseling area and the mental health and addictions area. Family violence is intimately connected to the work they do, and so our intention here was really to bring into one vehicle something that aligns with the work and has connections. Certainly, it was not, the stigma issue is not something that we considered as an issue here.
Thank you, Mr. Cooper. Mr. Blake.
Thank you, Mr. Chair. Just under aftercare, you know, as you can tell after our tour down to the treatment centres, that's the #1 concern is aftercare in the communities when our residents come back after treatment. And you know, at the moment we're kind of leaving it up to community members to take on whether it's AA groups or anything, but you know, I think one of their biggest challenges is some sort of funding to set up. You know, we need a place to meet. You know, that's a main concern right now. Is you know, I know some communities may have a facility that the community may let them use, but you know, there's little things that these groups will need, like whether it's coffee, tea, you know, while they're meeting a couple hours a week or something. But you know, it's really important that we do set this up and have something available to the communities to get things rolling, because that was the #1 concern for a lot of people that we spoke to down there. You know, at the moment there's really nothing in the communities to help them with their recovery once they get out of treatment, and you know, that's the #1 downfall. Thank you.
Thank you, Mr. Blake. Minister Abernethy.
Thank you, Mr. Chair. Mr. Chair, we clearly heard that when we did our facilities tour, and it is something that I feel is embedded and intended to be embedded in this plan. It's also following up on recommendations that the committee made after their tour. Our commitment, and I believe I've made previously, is that we're going to reach out to the communities. We got to remember, though, and I think it's critically important to remember, that these peer support groups are grassroots groups run and organized by the people that are actually participating. In some of our smaller communities, the numbers of people that are participating is low, so we're agreeing to make space available, whether it's existing health centers or other things for use after hours where space is available. We're prepared to make telehealth available. Should they want to tie into different groups and have a larger audience. A peer group of 2 people won't necessarily be as effective as a peer group of 10 or 15. So we're prepared to do that. But we need to reach out to the communities, and we're intending through this action plan to reach out to the communities to find out, you know, what will work in their communities, what won't work in their communities. We've even had the conversation of making small amounts of cash available to do the things like make sure there's coffee and donuts available, recognizing that the smaller communities don't have the capacity to do some fundraising that some of the larger communities might. So through this plan, embedded in this plan, we will be reaching out to communities to figure out how we can support existing grassroots peer support groups, recognizing that when we traveled, we heard from pretty much every facility and residents in every facility that was something that was important to them.
Thank you, Minister Abernethy. Mr. Bolio.
Thank you, Mr. Chairman. Mr. Chairman, I have maybe a question for, I'm not sure how detailed we would get with this question, but I'd like to ask the department how much of this work in training for trauma, working in trauma, and so on will go on prior to completing this action plan.
Thank you, Mr. Bolio. Minister Abernethy.
I'm not sure I 100% understand the question. Is the member asking how much of that training will take place as a result of this action plan, or are we doing it already? I'm not sure what the member's asking.
For clarification, Mr. Beaulieu.
Okay, thank you, Mr. Chair. Mr. Chair, I've been kind of thinking about this a lot lately, and kind of come down to the conclusion that many of the addictions, mental health issues are a result of trauma. And so I'm wondering what's being done there first before moving into things like treatment and other strategies on trying to help people with addiction problems and help people with mental health issues. And I'm just kind of, I see here in the very first objective there's trauma training. I'm wondering if the department or the minister could elaborate on what training and trauma-informed cultural respect, but my main interest focus on the trauma issue.
Okay, thank you, Mr. Beaulieu. Minister Abernethy.
So, Mr. Chair, our residents aren't going to wait for us to finish the training. So we're going to continue to provide services and get people to the supports they need while we're doing the training to make sure our staff are trained in this particular area. And some of them already are. There's many that already are, but we're looking at more standards around our community councillors. We're looking at more protocols around our community councillors so that they can provide greater ranges of exactly that type of support. We're also going to embed the cultural safety training as well. So there's multiple things happening. There's multiple training streams. One of the things that we want to make sure is that, and I think we heard this when we traveled to the communities as well, is when somebody's getting a referral for an out-of-territory treatment, we want to make sure that when they come back, that they have a plan in place to help them manage their return. And currently we do that, but we want to strengthen that. We want to make sure that things are more set up and more official before they're coming back so that they can get the supports. We all know that a person coming back can say, I'm done, I'm not going to any more counseling, but we want to encourage them obviously not to, and we want to set up some of the more of those standards up front. To the point that we're even looking at, some of the individuals who may have complex or more complex needs and aren't sort of more of a one issue or a one or two issue thing are referred to things like integrated case management where they can get some support. So when it comes to the training is going to be occurring over time. We're not going to stop providing services, but that training is essential to the ultimate outcomes that we're looking for.
Thank you, Minister Abernethy. Mr. Beaulieu.
Thank you, Mr. Chairman. Mr. Chairman, the other thing that I'm interested in is the changing the approach to this. Right now, we have a large population of people that don't have issues, either mental health or addiction, and then we have a group of people that do. Right? So we're trying to address that issue. It's like I've always believed that we have more of alcohol issues here, just sticking with just the alcohol issues, because we haven't been engaged in alcohol for a long period of time. Like, even if we say only 100 years, okay, we'll say. Could be more, could be less. However, Europeans have been engaged in alcohol for thousands of years. So it's kind of weird, but I'm thinking that people could be adapted to living with alcohol. Alcohol is a part of our society. Drugs is part of our society, and people to live with this addiction, and that in future generations there will be no need for treatment centers. There will be no need for this type of process, because a lot of the mistakes made by government and traumatizing people is no longer occurring. That's my belief anyway. So I'm wondering if there's ever a move to say, looking, this is a good 2-year strategy action plan, but to look at something like 20 years down the road, to make the moves now today, so that 20 years down the road, this issue is completely gone from our society.
Thank you,
Thank you.
Thank you, Mr. Beaulieu. Minister Abernethy.
Thank you, Mr. Chair. That's a massive question, right? And obviously, as a government, we're trying to do things that set our residents up to live productive, effective lives, and providing them the tools through education. We're committing to housing. We're committing to education. We're looking for opportunities for more education. We're trying to right some of the wrongs, the historic wrongs that have taken place. This plan talks about a specific 2-year period where we're trying to set some foundational work and some program work that will actually provide those individuals struggling today with the resources and tools they need and make sure that they have adequate care. This is a 2-year plan. I mean, straight up, we all know there's more that needs to be done. But we had to figure out what was doable, what was going to provide us with real impact over a 2-year period of time. These things will be in place, and we'll be in a better position to look at the next steps. And there's things that aren't in this plan. I mean, we've heard a lot of people talking over the last number of years about the medical side of addiction and whether or not there's other opportunities for medical treatment of addictions rather than some of the types of things we're doing. That research is still going on at a national and international level, and we are paying close attention to those types of things, and that may inform future plans. But for the time being, what we've heard from our residents is we need to focus on these types of things and provide more options today and better options and make sure that the options that we're providing are effective and are seamless, which is why the seamless care pathways is so important. It's also why the advisory council is so important. Those are individuals with lived experiences. So individuals who have gone through the treatment and can help us, help us solidify our pathways, solidify our plans to provide programs that are actually effective for those individuals who are struggling, as opposed to others who are looking at the people struggling and assuming we know what the solutions are. We're looking to the people who have actually had the challenges.
Thank you, Minister Abernethy. You're good. Mr. Beaulieu?
Thank you, Mr. Chair. I have no other questions at this time.
Thank you, Mr. Beaulieu. Mr. Natalie.
Yeah, thank you, Mr. Chair. I think what needs to be acknowledged is that we have the highest rates of alcohol and drug abuse here in the Northwest Territories, and it's very problematic because, I mean, a lot of our good people, go down that path. Whether it's because of trauma, they get lost or pulled into the whole lifestyle of addictions, and at some point in their lives, say like a teenager gets impaired, so they have a charge, and they carry that with them, and then down the road, they have a family, and then within that family, there's a lot of abuse that happens, whether it's relationship abuse, psychological abuse, but people carry their issues with them for a long time. So I think that's fundamentally has to be acknowledged. That here in the NWT we have some very pressing issues, and that should be like an immediate urgent matter that we put all our resources towards to, and realizing we don't have the facilities. We acknowledge that too. We don't have a treatment center here in the Northwest Territory, so we have to focus on our program and services that the government should be able to deliver to people in communities. And so the point that I'm trying to make is that I think that has to be acknowledged front and center. The other point that I wanted to at least highlight is whether there's an effort to maybe track, the cannabis has been legalized since October, whether that's going to be tracked in terms of its potential abuse, and whether the department will even perhaps maybe have some statistics that could be mirrored with alcohol addictions and some of the treatment options that have to be developed.
Thank you, Mr. Natalie. Minister Abernethy.
So I believe we do acknowledge exactly what the member is talking about, but it's important to remember that this is one plan in a magnitude of actions that are being undertaken. To address some of the root causes means we need to be addressing poverty. It means we need to be addressing housing issues. It means we need to make sure there's work available for people, the types of things that keep people actively engaged in community, and not in a state of crisis where they may be abusing alcohol or stuff. So this is a piece of the larger puzzle. but this focuses on those individuals that are struggling. The other things we're doing, like improving education, improving housing opportunities, and trying to create work opportunities, those all build to the fabric of the territory we want and go to the exact issues that the member is talking about. With respect to, it's not in this plan, but with respect to cannabis tracking, we know and we acknowledge straight up that now that it's illegal, we need to start to track usage and understand the impacts of that usage. So in our budget, we actually created an epidemiologist position whose focus is actually to track the usage and impacts of cannabis on residents of the Northwest Territories and systems, so that we can make informed decisions about those potential impacts, which we don't fully know yet. I mean, it's just only legal now, and we've only started doing those assessments. But if we start to see evidence, we will have the evidence and the information we need to make evidence-based decisions. This plan, and I want to be clear, this is a draft. We're looking for input from committee on things that you feel are missing or things that we can put in here to make it stronger. We want your feedback. We want your input. And committee has traveled and attended facilities and has provided me recommendations previously, which we've tried to incorporate. But we want this to be strong. We want this to be supported, and we all need to work together, recognizing that this is a piece of the puzzle. It isn't alone and by itself going to solve all the problems.
Thank you, Minister Abernethy. Mr. Nedley.
Thank you, Mr. Chair. The other part of this question that I have is, it seems the minister has stated that there's some dialogue happening with the federal government, looking at some efforts in terms of how two governments could come together. And I just wanted to understand, there's been an effort in terms of developing land-based supports. I know there's reference to mobile treatment and looking at some treatment programs that could be delivered at the community level. How is that initiative being reflective of what's been said in the whole reconciliation philosophy that, we'll try to at least develop on the strengths of First Nations culture and outlook in terms of life and perhaps, healing and wellness. I just wanted to understand that.
Thank you, Mr. Nedley. Minister Abernethy.
So many of the times when we're working with the federal government, it's usually trying to obtain some fundings based on the different funding pots that they have identified or made available, and often those are application based. So we're often seeking funding. We've been able to get money from them to help us with our suicide prevention and crisis response. We've been able to get some money for them on working around cannabis and making sure we're getting information out there. So those types of things. When it comes to working with our Indigenous partners, there's been an acknowledgement, I think, on all sides that land-based programming is incredibly valuable, and we've tried to partner with it. It's not necessarily in this plan, but by way of example, Ketladeche has recently obtained the old Natsujage facility where they're providing a wide range of programs to support healing and wellness, which support the thing that we're trying to address here. And we're certainly, I think we've already actually, rented the facility from them a couple times and partnered with them on a couple different deliveries of training and other programs. So there's lots of opportunity for that. We've put more money into mobile treatment options for Indigenous governments with the intention of working with them to help facilitate more aftercare and more supports that way, building upon the incredible work that they're already doing around on-the-land programming, which we've also been very supportive of, and encouraged other people to be supportive, like the On-the-Land Collaborative and those types of things. We've talked about AA and other peer support groups. We need and we intend to be reaching out to the communities to find ways, building on Mr. Blake's questions about how to support more peer support groups in those communities. And sometimes those communities might be of a size where the number of individuals who are looking for peer support might not be big enough to be a group by themselves, but we need to explore the possibility of having opportunities to connect with larger groups. We don't really have that peer support group problem in Yellowknife like we do in some of our other communities, so we need to reach out to where some of our residents are.
Thank you, Minister Abernethy. Mr. Nettle. Nope, nothing further. Mr. Tester.
Thank you, Mr. Chair. I just want to make a comment first, but I tend to agree with my colleague Ms. Green's point around family violence being included as part of the strategy. I don't think it quite fits the way as seamlessly as the other pieces do, and I think the efforts to destigmatize mental health are substantially different from the efforts to destigmatize family violence. So as this is a draft plan, I wanted to make those comments known to the department. I had a question around the work that's being done towards alcohol specifically. As you know, there is no territorial alcohol strategy, and there are no territorial alcohol guidelines or standard guidelines. Other provinces have engaged this work. Is that something that's going to be forthcoming? Thank you.
Thank you, Mr. Tester. Minister Abernethy.
Thank you, Mr. Chair. And I hear Ms. Green's comments and I hear Mr. Testart's comments around family violence. And like I said, this is a draft. This is not a final document, and we are looking for input. And we see a linkage there, but we're open. We're open to making modifications as necessary. With respect to the second part of the question, that's in this plan. That's part of the work that we're going to be doing through the advisory council, and we will be developing that alcohol strategy similar to what other jurisdictions are doing. Maybe we can go to the Deputy Minister for more information on that.
Mr. Cooper.
Certainly, thank you. So yes, we are going to be establishing a task force, and the first objective of the task force is going to be to focus on an alcohol plan, and that will look at all of the levers that we have, regulatory and otherwise, to try to curb alcohol use, to try to improve services and so on. I would expect out of that we will be seeking advice on things like I've just drawn a blank on the alcohol use, alcohol. No, the using alcohol as part of treatment.
Managed alcohol.
Managed alcohol, my goodness, I apologize for that. We'll be seeking advice on managed alcohol programming and looking at service standards. So our focus of year one of that task force is going to be all about alcohol.
Thank you, Mr. Cooper. Mr. Tester.
Thank you. I think that'll be helpful. And just as long as we remain focused on, I'm not sure if I heard abuse or use, and there's a difference between the two. So as long, I think safe use and education is a big component of this as well. I think part of the reason we've struggled is the tendency towards prohibition rather than the tendency towards education and responsible use of substance. And with cannabis now in the market as well, I think we need to double down on education campaigns for responsible use. Because if the assumption is it's used to be abused, then we're headed on the wrong path, and we're not destigmatizing. Secondly, if you could provide more detail on the stepped care or seamless care model. I have many constituents who are concerned around the mental health or counseling appointments and wait times and all that. The minister knows about this. So if you could provide maybe something more concrete as to how this model is going to deliver results that you can get same-day appointments. Thank you.
Thank you, Mr. Testart. Minister Abernethy.
Thank you. I'm going to go to Sarah Czartkowski for the second part of the response. With respect to the sort of the communication, getting information out there, we did get some money from the federal government out of around cannabis education and awareness, talking about safe and responsible use as opposed to no use at all. I just want to be clear that with that money, we're also going to be moving forward with a polysubstance sort of approach, talking about safe and reasonable and responsible usage and addressing not just cannabis, but multiple intoxicants and other things that are out there. So we are going down that road as well. With respect to the counseling work we're doing on seamless care, I will go to Mr. Czartkowski.
Thank you, Mr. Czartkowski.
Thank you, Mr. Chair. Yeah. Definitely, we've heard also that wait times can be a concern for people. We also know that face-to-face counseling in scheduled hour-long blocks is also not necessarily what everybody needs. So that's part of the seamless care pathway that Mr. Cooper spoke about, is matching the service to the actual need of the person. Not everybody needs that approach. It certainly needs to remain part of the continuum, because for some people that is what they require. But what we want to do is we want to look at implementing some other options. So e-mental health is one of the options we're looking at. So it could be an app-based program that somebody could do on their own, at their own pace. They don't actually need any support from a therapist to do that. There's also online and app-based options for people that would require the support of a therapist as well, in addition to the work that they would do on their own. So looking at e-mental health options is one of those things, and I think that when you are better matching somebody to the support that they need, and not scheduling them into a counseling appointment that's perhaps not what they need, then that frees up some time for that counselor to see people who actually do require that service. In addition to that, Mr. Cooper alluded to this as well, that we're looking at figuring out flexible scheduling options. So figuring out a way that we can offer, sometimes it's called a same-day walk-in, sometimes it's called a one-at-a-time approach to counseling. So, not assuming that everybody needs to come in and see a counselor week after week. It could be that somebody needs to come in and see a counselor once, discuss a few things, maybe take some e-based options with them that they can try, and then maybe they come back because it's not quite working, or maybe they don't because it actually met their need at that time. So when you provide more options that are better matched to what people need, then it frees up the time to provide to the people that need that more in-depth option.
Thank you, Minister Abernethy.
Thanks, Mr. Chair. And I don't feel like this conversation's over. I think there's so much we could be talking about in this area, but we did have an hour set, and I do have to go to another appointment. As we move forward for this, we want your feedback, we want your recommendations, we want to make a document as strong as possible and manageable within a 2-year period, recognizing the challenges are certainly longer than that, certainly to Mr. Bolio's point. So we are looking forward to your recommendations. With this, there's a lot of things that are happening. There's a lot of evolution that's occurring in this particular area that needs to be communicated, and we've acknowledged that we need to do a better job of communicating some of the options that are available out there, some of the things we're doing with some of the treatment facilities, with the Indigenous governments, and we're committed to working to get all this information out in a way that's easily understood. But as the Deputy Minister indicated, the way we've done it hasn't always got the information out there, so we'll be reaching out to communities to find ways to better communicate some of the resources we have out there as well.
Okay, thank you, Minister. Just a quick question for you. This presentation and your speaking notes, can you share it with committee so we can share it out there with our constituents? Thank you.
We'll just go through the speaking notes and make sure that they're kind of random at this point. Bruce just was flowing through them, but we'll put them together in a format that's a little bit easier to understand, and I have no problem sharing those with committee.
And we'll be able to share that.
This is a public meeting.
Okay, thank you, Minister. Abernethy, I know we went a little bit over. I thank you very much and your staff for attending, and we will follow up with you for sure. Thank you.
Obviously, we want to get this out as soon as possible, and we want to incorporate your recommendations where appropriate. So how long do you think it might take to get back to us so that we can keep moving, keep this one trucking?
We'll get it to you as soon as possible.
Okay.
Okay, thank you.